So my name is Lourdes Cantarero and I am originally from Spain, but I work in Copenhagen and I'm an associate professor at the University of Copenhagen, the Faculty of Health and Medical Sciences. So I am myself an alumni. So I took this master's 16 years ago, and since then I'm in touch with the team. So I received an email and I thought it was a great opportunity, and I applied. Oh, it's a very beautiful feeling, actually. It's been very moving. I didn't expect that to be so exciting, and it's great to see that the program continues, that it evolves, that it develops, that it's even getting better. And it was great to see the team from Rennes again, and especially to see the students. Several things, actually. I would like to share with them my passion for adolescent public health, the methods that I use to engage young people in research, but also I would like to bring to them a sense of urgency. We need very talented and engaged public health professionals around the world these days, and I think that I can see that the students, they have a huge potential to really play different roles in the public health arena. So I chose to work on adolescent health, especially mental health, because it's a topic that is very close to my research and my interest. And I chose to ask the students if artificial intelligence can tackle health inequalities in adolescent health, and if so, how. So we ran a workshop where I presented first the scenario, what are the problems, but then we were interacting very fast. They were brainstorming ideas. We were having a debate about ethical dilemmas related to AI and adolescent health, and we actually developed together a code of conduct on how to use AI when tackling adolescent inequalities in health. So for me, interaction is everything. I'm not that fan of long lectures, so I start with what we call nano lectures, and very fast I present a question where they can reflect and then share together, and then we open the debate. I also like to engage them with bringing real life problems to them, so they can really contribute with their insights and their reflections. And then we use methods like brainstorming or other kinds of methods. And the interaction is actually fluid. It goes all throughout. And I'm very happy to see that it works, that they are very engaged. And that's what they actually reported, that the workshop was very engaging. So I was very satisfied with that. Yes, actually, I was very surprised that many came and said it was very engaging. It was very insightful, and some of them actually were working in the field, so we had good interactions and good technical discussions afterwards. Engaging, reflective, and timely. So I chose a case study that it's very hands-on. I thought that is fantastic that we are in this great city of Rennes, and it's a city that is committed to be a sort of a healthy city from the WHO perspective. So there is a lot of knowledge in the School of Public Health, and there is a lot of engagement at the city and the metropole to really become a healthy urban setting. So I thought this is a great opportunity for the students to work hands-on, to work local, but in a very relevant global problem. So with experts from the school who are really good in the field, we have developed this case where the students, they have to really engage with stakeholders, teachers, students, managers, leaders, support staff from the school to really gather ideas on how to transform the campus into a healthy urban setting. So I think it's actually very, it's a topic that is very relevant. It's related to One Health, to planetary health, and I'm really looking forward to the innovative solutions that the students are going to come up with. So we have had a presentation about the case. I explained the methods, the innovative tools that they can use. We have a website where they have free access to all methods, many methods. We are going to use design thinking for this process, and then Professor Anne from here, from the School of Public Health from Rennes, she presented the technical content and the setting. And then we went for a tour around the campus, where she was showing us the different places, the trees, so that the students get to know the context. And it was very insightful, and I think they were very, very engaged. Oof, for me, Europubhealth was a before and after in my career. So I started as an economist working in low and middle income settings, and I didn't know much about public health, but I saw what poverty can do to your health. So I started to develop this interest in public health, and I went for this program, and it's probably one of the #1 decisions when it comes to professional decisions in my life. I linked socioeconomic inequalities to health, and it's actually this master that allowed me to see that 16 years ago. That was a revelation for me, and still it's one of the core of my works, of my research works. So very, very glad for that. Personally also, because, well, I moved to Copenhagen. I work for the WHO Europe. I work for different countries in Europe, but I settled down, and now I'm working for the university, and very glad to do so. So I think that Europubhealth is a program that, because of the different partners and their engagement and their expertise, and then because they choose talented students, it's a program with a lot of potential, and we see very, very interesting alumni that are part of this program. I think there is an effort to keep the content very much updated and relevant, and I think that is a very good asset. And I think that the profile of the students, they are so talented and engaged, is really wonderful to see. So it's a very special program. This is a very interesting question, actually, because I think that as a student, sometimes we are very much focused on what to do, what is expected, gaining knowledge, and I think that we have to create space for reflection. So after a lecture, take the time to reflect, and take the time to write, to journal a little bit. The students here, they are already graduates. Many of them have professional experience, so they can really reflect and relate to the content and to what they learn in a very, very special way. I think time for reflection, individually and with others.